Okay, well, good evening, everyone, and welcome to this evening's session. I'm glad that you're all here, and I thank you all so much for your interest in joining me during this innovative education session, moving from Keegels to Heegels, where we are going to learn how to revolutionize the way that we train the male pelvic floor, post-prostatectomy, and post-radiation therapy. My name is Christina Dzieduszycki, and if you think that's difficult to say, wait until you try and spell it. I am a registered physiotherapist, and I've dedicated most of my professional career to public health. Throughout my career, I've developed a special interest in supporting men who have undergone or are currently undergoing prostatectomies as part of their cancer treatment. My work focuses on helping these patients navigate the unique challenges associated with such treatments. Now, my journey in this field began over 2 decades ago with a passion for exercise that eventually led me to pursue a master's degree in physiotherapy. After a decade of clinical practice, I noticed a significant gap in research and best practices concerning pre and post prostatectomy care. So, this realization initially drove me towards doctoral studies. However, I soon realized that my true strengths lay in clinical practice and knowledge dissemination. This is why I'm here this evening sharing this information with all of you tonight. As some of you may or may not know, Australia is a hub of cutting edge research in men's pelvic health, particularly because they have the capacity to assess the male pelvic floor differently than we do here in Ontario. And we'll touch on that in a little bit later on in the presentation. But needless to say, this encouraged me to travel to Australia this past spring, in fact, where I had the opportunity to work alongside specialists. And there I gained a wealth of knowledge and enhanced my clinical skills. So today, my mission is to bridge the gap between research and practice, and I'm here to share evidence-based strategies and valuable clinical insights with all of you. I hope to empower all of you and provide you with the tools necessary to navigate the challenges of prostate cancer treatments. So without further ado, let's dive in and discover how we can move from Kegels to Heegels and revolutionize our approach to the male pelvic floor muscle training. The way the presentation has been divided for this evening is we're just going to start with a bit of background. And then once we establish the background, we're going to go into very brief anatomy. Many of you may or may not be aware of how it all works and certainly what happens once it changes. And then I've decided this time to present a case study. And really that's to help people who are interested in seeking help through physiotherapy to understand really what to expect when you come to New Life and receive pelvic floor physiotherapy. I'm also going to present you with our Prostate Pro program, and it's a 7-step program that takes you through the fundamentals of learning how to train your pelvic floor muscles and beyond. And as I mentioned, we'll have some time at the end for some questions and answers. Okay, so the prevalence of prostate cancer is fairly significant. It's the second most reported cancer in across the globe. And in 2018, there was over 1.25 million cases reported, and that is projected to double by 2040. Here we see a map of the globe and where we see higher levels of incidence rates, we can automatically see that they're right here in our yard. There are other things that you could probably draw from this map and questions that you might start wondering, well, why is it so concentrated in North America and not so much in other parts of the world? And for myself, I automatically think of lifestyle. And among other things. But we do understand that there is clearly a high prevalence of this condition in our own backyard, which means that we really do need to start basically overcoming these barriers that men are facing to receiving the care that they so very much need and deserve. So what are the prostate cancer treatments that are available to men? who've been diagnosed with prostate cancer. As many of you are probably aware, and as the poll indicated when we started tonight's session, there's a large proportion of you who've had prostate removal through radical prostatectomy. And this is usually a treatment that's provided to younger men. And the reason being is that radiation, if that was provided to a younger man, would likely end up causing some other form of cancer later on. And so the reason why older men tend to be exposed to radiation versus younger men is naturally that if you're 80 and diagnosed with prostate cancer, you certainly don't have as many years as a man who's diagnosed with prostate cancer at the age of 50, for example. So those are your kind of the top two cancer treatments available for men. And at times, as you'll come to see through our presentation, you can have a combination thereof, which some of you have had. And I have included here hormonal therapy. And this is really a big piece for physios, particularly because when a man is on hormone therapy, there's a significant loss of muscular strength and cardiovascular endurance. And that has to do a lot with the suppression of testosterone. So naturally, physios have a big role in terms of preserving strength and cardiovascular endurance in this patient population. So if you're on this therapy, then perhaps it's worthwhile thinking about the benefits of starting some physiotherapy sessions with a local physiotherapist. And I will ask Jim just to mute everybody if possible. Thank you. All right. A number of you are also on active surveillance, and that is just because cancer or this prostate cancer is a very slow progressing cancer. And if it's not necessary to remove it immediately, then why put yourself at risk if it can just be monitored and carefully watched over time? That's usually why this is an option as well. So the complications. Many of you are probably aware that urinary incontinence
Christina, you're
You're
muted.
just on mute.
Sorry, when did you lose me there?
Right at this slide,
At
beginning
this
of
slide. Okay. Thank you.
Well,
I'm not sure
2 seconds
how
ago,
that happened,
sorry.
but okay.
I
All
knew
right.
you
So
all.
So as many of you are aware, after having your prostates removed through radical prostatectomy approaches, urinary incontinence tends to be one of the most common side effects that men will experience, and it can happen in up to 80%. Another type of incontinence that is very common too, and approximately 50% of patients can experience this, is urge incontinence. So in that situation, your bladder is contracting, and the pelvic floor muscles are insufficiently strong to be able to override that bladder contraction. So we have quite a number of patients in those circumstances as well. Now, the other three, erectile dysfunction, loss of penile length, and Peyronie's disease, this again has to do more with one's sexual health, and we'll touch on that in a little bit later on in the presentation. But suffice to say that 1 in 6 men will experience Peyronie's disease post-prostatectomy, and that can appear roughly about 14 months post-op, whereas 1 in 8 men can experience this condition post-radiation. But the difference is that it appears within 3 years after radiation exposure. So that leads me into this slide. What causes urinary incontinence post-radiation if you're not removing the prostate? And many of you may know that radiation is the gift that keeps on giving. And the changes that occur over time, that occur to the tissues, they keep basically building up over time. And this condition is also known as radiation fibrosis. So essentially what ends up happening is that every tissue that's been exposed to radiation just undergoes this stiffening, and they become very rigid. And so once a tissue is no longer stretch or able to stretch, it's going to obviously be compromised in terms of its overall function. One of the big things, and you know, a medical emergency is a stricture. So these images that you see on screen, if that were to happen to you, where you notice that you have a full sensation, like you have a strong urge to pee, but nothing's really coming out and you're just getting small little drops, that's overflow incontinence, and you want to get to the doctors fairly quickly to be able to receive a procedure that will open up that area and then allow you to void appropriately. So all of that to say, I mean, this looks pretty daunting and it doesn't seem all that pleasant. However, exercise has been shown to be an excellent solution for preventing this radiation fibrosis from appearing. And it certainly has been shown to help with pelvic floor muscle control and also manage the inflammation. So inflammation, if you translate inflammation, it means to be set on fire. Anything that is set on fire is not going to be working at its best. And so when we exercise, we can manage the inflammation that comes from exposure to radiation. So it is highly, highly encouraged to get into an exercise program if you are not already involved in one. And that can very easily be done with a physiotherapist. Some of you will have had a prostatectomy done and then a process called salvage radiation, which is where you'll have the tissues radiated beyond the margins of the prostate. So the target area becomes a little bit larger than the original target area would had the prostate still been there. The problem here now is that you're now targeting tissues like the rectum, the bladder neck. And so you can end up with more severe incontinence in these situations. And now, unfortunately, also potentially rectal issues, whether it's diarrhea or constipation or a combination thereof. So for a long time now, we've been questioning, whether or not we should be Keegling or perhaps something else. And the reason why we're now questioning whether or not Kegels are the best approach for managing these side effects is because there's some new research and some new evidence that has come out, and I'll share that with you in a minute. But traditionally, we adopted this Kegel approach because back in 1940, Dr. Arnold Kegel, hence where we get the name Kegel, developed this technique to help women postpartum who were having incontinence. And so they basically assumed that they could just extrapolate what they used in that patient population and superimpose it on men who are having the same condition or the same symptoms. And initially, some of the studies that were done, there were some promising results. And so it kind of spread like wildfire because of the initial evidence that supported the effectiveness of this approach. However, time went on, and a Cochrane review was performed in 2015 and again in 2019. And what it basically indicated is that this approach was insufficient and ineffective for managing post-prostatectomy incontinence. So you can imagine that now we're thinking, okay, well, what do we do? If this is not an effective approach, perhaps we need a new approach. And hence why I'm here today to introduce you to the Kegel. And this is what the research is now very clearly demonstrating is the most effective way to treat this incontinence in men post-prostatectomy and radiation. I have here on the screen that there's a delay in knowledge translation. So in the poll that I asked everyone at the beginning, how many people received a sheet of paper with explanation on how to do Kegels? And a large number of you did say that you received this sheet of paper. And so unfortunately, the old ways are still being implemented and utilized throughout our healthcare system. While I was in my doctoral studies, one of the courses I took was called Knowledge Translation. And I became aware that it can take up to 10 years for evidence to reach the target audience. And that target audience could be doctors, it could be physios, it could be yourselves. And so, as you can imagine, we really have to find ways to be able to get this evidence to the target audience much quicker than our traditional approaches of research articles, which if any of you have ever read a research article, it's full of medical jargon and incredibly difficult to interpret. And then also the other way in which evidence was disseminated is through conferences. And again, that's very costly and you are being bombarded with an abundance of evidence rapidly at 20-minute segments. And so it's very difficult to be able to take all that evidence and then implement it into our own practice. Hence why I am trying to overcome some of these barriers and disseminate some of the evidence that I've had the privilege of learning about with the target audience, in this case, you guys this evening. And in October, it'll be with other physiotherapists that I am going to be training so that there are more people working with men in your situations. So because we knew that there was something more that needed to be done, something different that needed to be done, we discovered this, particularly in Australia, and I had the great privilege of working with this and taking some training on this this approach. It's called transperineal ultrasound imaging. And essentially, what it does is it improved our understanding of the way the muscles worked and work, and also what happens, how things change once the prostate has been removed. The other thing that it does is it's a really great biofeedback tool. So men can visually see how they're
Excuse me.
recruiting their pelvic floor muscles. And I'm just going to play the video here. So this animation above the video basically gives you an idea of the muscles that you're seeing in the ultrasound. So there's a muscle under the green arrow, there's a muscle under the blue arrow, and then there's a muscle under the red arrow. Okay. And there's this kind of wand, if you will. We call it a transducer head, and it gets applied to the bottom of the perineum, so just in front of the anus, and then we are able to see the inside of the pelvic cavity. So here's a video, and just let me know if you guys are able to see this play. So that's a contraction. Okay. And men are using this in Australia to really isolate the proper contraction, and then they can really see when they're generating too much pressure from above, and you can see that the entire pelvic floor will drop. And there's a lot of videos here that you, as you kind of watch and see the kind of like a good quality contraction versus a poor one, you start to learn how to enhance your pelvic floor contraction. Now, beyond just learning that we need to adopt a new way to contract the pelvic floor muscle, we also have this evidence that came out in 2022, systematic review. So in terms of levels of evidence, we've got a systematic review being our highest level of medical evidence. And in that paper, they very clearly indicated that comprehensive functional physiotherapy exercise regimes are very beneficial at helping with the management of urinary incontinence. And these exercises done preoperatively can be more beneficial than strictly postoperatively, but they also have a tremendous benefit done postoperatively as well. Okay, so at this point, I am going to ask everyone just to take a quick posture break, maybe just stand up, give yourself a little stretch, and you'll understand and appreciate why I'm asking you to do this in a minute, because sitting for any extended period of time is not beneficial for your pelvic floor muscles. And in fact, it shuts them off and it makes it a lot harder for you to maintain continence. So please, everyone, just take a posture break, get off your bum, stretch, give yourself a good posture stretch. Sit up nice and tall. And I hope everybody took advantage of the posture break there. If you want to stay standing, I encourage that as well. I really don't promote prolonged sitting, particularly in this patient population, and you'll come to see why in just a minute. Okay, so in the anatomy now, what we see here on the screen is the pelvic floor, and essentially you're looking at your two sit bones. So these two yellow arrows that are showing up on the screen, those arrows indicate the two bones that you're sitting on. If you're standing now, then maybe you want to have a quick seat just to feel for those bones. And between those bones, you'll find your pelvic floor muscles. The area that we are most concerned with when we're trying to learn how to Kegel is the area that is in the front. And we call this the front triangle, okay? So that area in the front is where you'll find your sexual function and your urinary control mechanisms. If you're not familiar with what you're looking at in this image, you're actually seeing the three muscles that make up the shaft of your penis. And this muscle here in yellow is the one that houses the urethra. So now you can probably start to appreciate that, oh, if it holds the urethra, then it's probably involved in my urinary control mechanisms above and beyond just sexual function. So if we move here, this image is very kindly provided from Paul Hodges and Ryan Stratford. They've done just numerous amounts of studies, and these animations have been very helpful in trying to explain kind of to patients what happens. And so what you're seeing here now is similar to the image that I showed you when I was showing you the ultrasound imaging, but now you're seeing that the green arrow is the muscle of sexual function that houses the urethra. Then you see the blue arrow is the circular muscle that wraps around the urethra, so also involved in incontinence control. And then the red arrow is representing the puborectalis muscle, and that muscle pre-prostatectomy is also involved in urinary control. However, once the gray structure, which is your prostate, once that structure gets removed, the scenario changes. And now we end up with a bladder that is all the way down, located behind that puborectalis muscle. So if you think for a moment, if I use the technique, the Kegel, that all or nothing, like back to front approach, and I use that for men who are having incontinence in this patient population, chances are it might not work so well, because if we use that back muscle, we're probably squeezing down on the bladder and causing incontinence. So hopefully that is starting to make some sense to everyone that's watching tonight. So we really have to think about how we're using these muscles and what position are we putting ourselves into to be able to recruit and isolate these muscles. Here's another image of the anatomy and the three different layers of the pelvic floor. What I showed you previously were the three muscles that you saw and how those three muscles of sexual function become the shaft of the penis. So incredibly important in regaining sexual health after prostatectomy. And this is something I'll talk about in a little bit more detail as we get to early penile rehab. And then the middle layer, which you saw previously, is the circular muscle that wraps around the urethra, and that's involved in the continence mechanism in combination with those muscles of sexual function. And the deepest layer has numerous other functions to support and stabilize and to pump fluid through the system. So it's a very busy place. I have this slide here just because I want everyone to understand why that study that I talked about earlier, the study that indicated that comprehensive functional training is beneficial for managing urinary control. And that's because we have to think beyond the pelvic floor. And the pelvic floor we know works with other muscles like the diaphragm, the deep core muscles, some deep spinal muscles. Our respiratory system is very much involved in controlling the pelvic floor as well. And each of these muscles work like gears on a bike. So if one of the gears aren't working all that well, it's going to impact the function of one of the other muscles, particularly the pelvic floor, and then ultimately the system either fails or it just doesn't work as well as it should. Okay, so that's why comprehensive training, way beyond just doing the Hegel, is absolutely critical in our programs when we're treating this patient population. Now, there's a huge role between posture and continence. And we know that the pelvic floor muscles are postural muscles. When you sit for a period of time, you're going to essentially shut off your postural and pelvic floor muscles. So a lot of people might, experience these moments where they're sitting and then they go to get up and they lose control. And that's likely because the pelvic floor muscles have been shut off. And so it might be advantageous for you to take frequent breaks every 15 minutes and stand for 30 seconds and move around so that your muscles aren't shut off and that they are working for you during this time. Now, all of these instructions that you see here on the screen, all these little strategies, they're all going to be included in an ebook that will be made available to all of those who are interested in receiving it. And I'll talk more about the ebook at the end of tonight's presentation, but you don't need to frantically take notes because you are attending the session tonight. You will have access to this ebook for free. Okay, so you don't need to take notes because some of you are, I'm sure, note takers, and it'll be made available to you shortly. Now, the position of your pelvis is also incredibly important, and many of us tend to sit for hours and hours on end, and as a result, that can lead to tight hip flexors. We know that tight hip flexors have an effect on our bladder control, and so how your pelvis is positioned is going to be something that we also consider in our time together when we work with our patients. I'm just going to show this video here because many of you are probably not aware of what the hip flexors are. You've heard of these words, I'm sure, but I'm just going to give you an idea that if you look here, this is your pelvis and there's your spine. Okay, there's the sacrum. Now, one of the hip flexors start on your spine and then they join the hip flexor inside your pelvis. They go underneath the inguinal ligament and then they attach onto your femur. So when these muscles are tight, they're going to cause the pelvis to tip forward. Now, what else happens in this situation is that if these muscles are tight, not only is the bladder and the pelvic floor not going to be positioned properly and or working optimally because there's going to be some resistance basically in the pelvic floor if the pelvis is stuck, and then the pelvic floor muscles have to work extra hard against this huge pelvis that's just not moving, and these muscles are tiny, as you guys have seen now. The other thing that happens is the glute muscles, so your big muscles on the outside, they actually can't get activated because if you can't bring your knee behind your hip because these muscles in the front are so tight, all of a sudden now you can't activate your glute muscles. And we know now through the research that when you activate your glutes, there's a co-activation, automatic activation of the pelvic floor muscles in the front. So that's kind of interesting and unique, right? So if you think that you might be somebody who has tight hip flexors, then having a look at that and trying to figure out how to stretch those out would probably be in your best interest. Fortunately for you, we have something in the ebook about that as well. Now, this is a really cool patient resource that I've included here because I received this in Australia, and I'm happy to share this with you guys. It'll also be in the ebook, and it's a video that basically walks you through the whole process, and then it gives you some pelvic floor training kind of exercises to do at the end. Really, really cool video. And some of the images that you'll see that I'm going to be using in a minute are going to be pulled from this video here. So when we're doing a pelvic floor contraction, the big important thing is to make sure that we are not generating any excessive pressure from above. And what ends up happening most of the time is that men will use their core muscles instead of isolating their pelvic floor muscles. And when that happens, you can imagine there's too much pressure from above, and then it basically overrides the pressure that the pelvic floor muscles can generate, and then you lose the battle, and then there's a leak. So with the techniques that I use in my clinic, although I can't use ultrasound yet, and we're working with the college, hopefully they'll allow that to be a part of our scope of practice in the near future. But in the meantime, I'm using another evidence-based technique called surface EMG, which is also another form of biofeedback. And here I am able to help men isolate their pelvic floor contraction to their abdominal contraction. So you'll get an opportunity to see that in just a minute as well. Now, here is an image actually pulled from the resource that I got there from Australia. This is basically men have this huge advantage over women because men can stand naked in front of the mirror and they can look at their appendage and observe the movement of the penis coming towards the body. And that would essentially confirm that they're using their pelvic floor muscles appropriately. Because remember, the muscles that we're interested in are the ones that become the shaft of the penis, right? And the ones located in that front triangle. So if you see in the mirror when you're trying to draw your penis in towards your body and you can see your penis recoiling, then you know you've got it. You've just got to watch that your stomach isn't getting pulled in or activated with this contraction. The other cue that's often given is stopping the flow of urine. And so this is where a lot of men, they hear that and they're like, okay, great. I'm going to go and I'm going to practice while I'm peeing. Please don't do that. There's about 22, maybe even 23 reflexes that the body has in place to be able to initiate a bladder void. So interrupting that reflex constantly because you think it's a good idea to train during that time, probably not a good idea, right? Because that could just cause a world of other problems that you do not want to deal with. So please, if you can, just practice stopping the flow of urine any other time other than when you're peeing. Okay. All right. So at this point, what we'll do is we're going to practice the Kegel. We're going to see how many of us can actually feel these muscles working without feeling the belly activating. And we're going to start in a very simple position in this forward sitting position. So I would ask everyone just to slide all the way forward to the front of your seat, because I'm going to assume that many of you were leaning back and possibly slouching. So I'm just going to ask everyone to slide all the way forward, and it's almost like you're at the very, very edge of your seat. And then open up your legs nice and wide, just like you see on the screen. Place your forearms on the desk. And while you're in that position, I want you to imagine like you're trying to draw your penis towards your body. Or maybe the cue, stopping the flow of urine, works better for you. And what I'd like you to do is contract at a rate of 1 per second. So squeeze, release, squeeze, release, squeeze, release, squeeze, release. 4, 5, 6, 7, 8, 9, 10. Now, if you were unable to keep up, that's okay. It just means you need to work a little bit on this. If you felt you were pulling with your stomach, then obviously there's some work that needs to be done. If you kept up, then good for you. Okay, those are your pelvic floor muscles, and you've just experienced the Kegel. Now, let's just do it wrong, because I want you to see why I asked you to do this forward sitting position. So everybody just slouch back like you probably were before. Just go back into your relaxed sitting. And go ahead now and try that contraction. Try to do the squeeze, release, squeeze, release. And I would think that it's fairly fair to assume that all of you are feeling it in the rectum. Now, go back to sitting up forward and back into this forward sitting position that you were just in. And repeat that contraction and just sense that movement and how much it changed from the back triangle to the front triangle. And hopefully now you see, wow, okay, that's actually a big difference. So now it's all nice if you can do it in sitting when your pelvic floor is supported. That's great. And it's a good starting point, but it's not the end. It's only the beginning. You have to be able to hold this contraction as well. It's not just about being able to squeeze it and let it go. You have to be able to hold this contraction while you're on the move. Okay, so in this situation, you would basically contract the pelvic floor, make sure your belly isn't engaged, relax your belly, just keep the pelvic floor on. And it doesn't need to be 100%, guys. And I think that that's a big issue that I face with my men is they all want to do this all or nothing approach, just 100%, give it everything you got. But in this situation, interestingly enough, from the research we now know that we can't do the all or nothing approach that women were told to do. You guys don't have damage to your pelvic floor like women. You did not have any babies coming out of there. There were no tears. There was no trauma. Those types of things didn't happen to your pelvic floor. So you just need to understand how to control it, and you don't need to crush it. So just gently contract, something that doesn't cause an abdominal contraction, and then hold it and then stand while maintaining that contraction. Were you successful? If not, you need to repeat the sit to stand 10 times in a row. Do it slower. Make sure you're exhaling as you're moving from sit to stand. Some people are breath holders in everything they do, and that creates inside pressure. So that's not going to help. So you've got to find what the strategies are that you need to use that are going to help you be successful with it. And you have to repeat the activity that causes leakage 10 times in a row until you're repeatedly successful. And that's the thing too, that many people don't realize that if you have moments in your day where you're having leakage, you need to stop right there and do that activity and do it over 10 times. Because that's a training opportunity. I would way rather see my guys doing that than doing 3 sets of 10 seated pelvic floor contractions, 3 sets of 10 standing pelvic floor contractions, and then endurance contractions as well. I would rather see you implementing your pelvic floor contraction into movement 10 times. Because ultimately, that's how you're going to override your incontinence. You have to put the muscle into the exercise that's causing leakage. Does that make sense? And if you are somebody who practices your pelvic floor exercises while you're lying on your back, kind of useless, right? Because most people don't leak while they're lying down. People leak while they're moving, while they're upright, while they're transitioning, while they're walking, those types of things. So you have to start implementing these exercises, this Hegel, into the activities that cause leakage. And that's going to be variable from one person to the next. When you're practicing in standing, because you have to start somewhere, right? You're not just going to start sprinting. You're going to start slowly. When you're practicing in standing, you're going to assume the ski jump position that you see in the image as well. Notice that I'm not hinging at my hips, right? I'm not bending here and doing that. All I'm doing is I'm just shifting my weight forward, okay? And by doing that, again, the same experience is going to be felt that was felt when we were sitting forward versus sitting back. You're going to feel the front triangle engage versus the back triangle. And when you're standing, your abdominal cavity is going to be a little bit more active, but then this is just yet another challenge of trying to quiet it down so that the pelvic floor muscles are actually overriding the activity in the abdomen. And this takes practice. Some of you are maybe already working with me and are aware of how difficult this actually is. All right, this is a great deal of time here, but I did want to put it because one of the studies that have been utilized a lot, and it's primarily because of how specific it was with its training. The people in this study had an 88% improvement after 3 months. And in terms of their incontinence. And that was because this study was one of the very few studies that had like intensity, frequency, type, time. Like they had all the details that one would need to understand how to execute a training program. And that's the same thing applies when you go to the gym. If you don't know what the recipe is for muscle hypertrophy or muscle growth, you're not going to get muscle growth. And we know there's science now to back everything that we know, right? We know that there's 3 sets of 10 to failure creates muscle growth. We know that 3 sets of 20 not so much to failure, builds endurance. We know 3 sets of 4 to 6 builds power. Also very important after the age of 60, because you lose about 3 to 6% of your power muscles. You have power muscle fibers. You lose about 3 to 6% of those every year after the age of 60. And then men and women become more at risk for falls because those muscles are fast responding muscles. And if you are about to fall, you need to be able to catch yourself quickly. But unfortunately, as we age, those muscles disappear. But if you train them, they don't, not at least not at the same rate. So as part of the Prostate Pro program that we've developed, we also take that into consideration because the large majority of men that I work with are, if not over that age, or they're very much approaching that age. So all of these things are considered in the Prostate Pro program that we've developed at New Life. These two studies here are just to show the effects of preoperative pelvic floor muscle training. Again, just to show you that there's really this new and recent evidence, 2021, and then again in 2023. So it's really recent evidence showing that preoperative pelvic floor muscle training helps with the management of postoperative or postoperative incontinence. Okay. And then this again is that systematic review that I talked about the effects of functional training and how it's particularly effective in terms of urinary incontinence recovery. All right, another posture break if you'd like. Please stand up, stretch out. We're getting there. Now we are just approaching the point where we're going to go over a case study and so that everyone can understand what to expect when they come to New Life for an initial assessment. Okay. So what happens here is the initial assessment is a time when we gather an incredible amount of information. And if anybody has worked with me in the past, you'll attest to the fact that our intake forms are very comprehensive. And that's because it's important to know all the details because I want to make sure that the plan of care that I create for my patients is all encompassing, and that I'm not missing any details that might limit their ability to regain the quality of life that they're looking for. So not only do we talk about the kind of prostate cancer journey and where they're at with that, this particular patient came in 3 months pre-prostatectomy. So that's almost unheard of. Usually I get them at about 6 weeks, but this is now just starting to demonstrate that the doctors that I'm working with are really starting to understand the importance of sending their patients as soon as they find out. And so I'm really excited to see this. Because it's evidence to me that the work that I've been doing is starting to pay off, and that many of the doctors that I've been collaborating with over the years have been recognizing the work that I've been doing and are now on board with the importance of doing this. So it's exciting, but still lots of work to do based on the polls that you guys filled out at the beginning of today's presentation. So it sounds like my work is still underway. Anyhow, so once we get through the patient profile in terms of the cancer history, we talk about the medical history, because if conditions are present, then we need to assume that we address those things, particularly type 2 diabetes. If it's uncontrolled, we need to start getting the assistance from providers to manage this. And a big part of what we do as physiotherapists is help with the management of this condition. And so we tackle it very quickly, and we get our men on a strength training program as soon as possible. We start working with nutritionists because we know that if you are dealing with this, the chances of being continent after definitely become more tricky. And if there are any neurological symptoms, obviously we have to lose them about right away and address those as soon as possible, because we want to make sure that the state of the is optimized before it goes in for surgery. We also talk about things like bowel function, sorry, and if there's any issues with constipation or IBS, those types of things, it can have a huge effect on the function of the bladder. And so naturally, we're going to dive into those types of questions. Sexual health, is there any concerns about one's erectile function preoperatively? Because if there is, we need to get on some penile rehab immediately to get that function restored and optimized before going in for surgery, because it's certainly not going to be better after surgery. And then psychological factors. This is a really big one. There's a lot of studies now that have been done on the effects of psychological distress and the pelvic floor, and in particular in this patient population. And when men are exposed to trauma or stress, anxiety, depression, those types of things, the pelvic floor muscles will adopt an overactive state. They're going to tighten up. And unfortunately, as you can probably imagine, that's not going to allow for optimal functioning. And then what ends up happening is they have worse incontinence than those who are not afflicted with these conditions. So we have to highlight that. And we've got questionnaires in our intake form that allow us to detect whether or not this is something we need to address. And if it is, we've included it in our Prostate Pro program as well, because it's such a critical piece of the puzzle. And then, of course, your social life, right? We want to know what your goals are. We want to help you work towards that. We want to get you to, a quality of life that you can enjoy again, and that, that you're not dealing with the burdens of the aftermath of prostate cancer treatments. Now, when we meet our patients after the initial assessment, if they're post-op, we run them through the functional incontinence measure. If they're pre-op, then we teach this in preparation so that they can start making these exercises automatic. But essentially, these 6 exercises are known to be the most common exercises where men will report leakage. So walking, stair climbing, picking up objects from the floor, sit to stands, coughing, and sit-ups. And these are all exercises that we do all day long. Many of you say, well, I've never done a sit-up. Well, you have, because if you get out of bed, you're doing a sit-up. If you're, going from even sit to stand, there's a slight movement involved there where it's a mini sit-up, if you will. So we do need to test these, and we need to make sure that the pelvic floor is responding to these exercises in a favorable way, so that you're not living with incontinence with each of these movements. And then there's a video that we provide as part of our Prostate Pro program, and the video is here on the slide. I'm not going to play it just for the sake of time, but it walks you through how to execute this program, or this FIM measurement from start to finish, so that after we do the initial assessment, then we basically retest at 6 to 8 weeks following the initial assessment, and then we can see if there's been some improvements in the pad weights, because there's a pad weight, obviously, that's taken pre and then post. So that has been a really useful tool for us to use, and it's certainly something that we share with our patients. Now, part of our 7-step Prostate Pro program is mastering the Kegel, and this is the biofeedback that I was alluding to earlier. The biofeedback is the machine that you see there in the bottom. It's a little device that has wires that are connected to it, and then the wires connect to leads that we connect onto the base of the perineum. Those two red dots that you see on the screen, where you see the first layer of the pelvic floor muscles, that's where the leads get placed. And then on the other side, you see the two green dots, and that's where the leads get placed on the abdomen. And then what happens is the computer screen will project the image on screen, and you can see in the first scenario there, the first little kind of block, you can see that the red is the pelvic floor muscle activity. And so that's someone trying to contract their pelvic floor muscles for a period of 10 seconds. And as the muscle starts to fatigue, you can see there's a slight, I mean, this is not at all. I would be happy if all my patients looked like this on day one, okay? And some of you have done the biofeedback with me, and can appreciate that this is very difficult to execute. But what happens when the muscle fatigues is that the green, which reflects the abdominal activity starts to rise. And in the next set of exercises, it's a slightly different exercise, but you can see that obviously as the muscle fatigues, the patient is less and less able to generate the same kind of voltage as they were initially. And then all of a sudden, the abdominal cavity starts coming in to help. The second phase is powering up the Kegel. The first phase, we're really just focusing on endurance and optimizing your ability to just isolate the pelvic floor. But then once you've mastered that, and there's a self-test that goes with that, and once you've mastered and passed that self-test, then we move into powering up the Kegel. And what you see on the screen of that biofeedback machine is 0.7 and 0.9. And what that reflects is this gap in the screen in the chart. And you can see that basically everything looks like it's flatlined. And that is called switching off your pelvic floor muscles. Often all we do is think about, I've got to squeeze, I've got to contract, I've got to make sure I stay contracted. Nope, can't let go, never let go, just keep contracting. Well, unfortunately, that doesn't work. There has to be an ability to switch these muscles off. Because if all you do is squeeze, then your muscles are going to fatigue and you are not going to have any use of them at all. And you'll find that later on in the day, you're going to have worse leakage, you're going to have less control. And that's all because you're not giving them an opportunity to rest. And so being able to switch off the muscles is incredibly difficult, but also important. And so as part of the program, we learn how to do that. And then again, here you can see that there's very, very little abdominal activity. So this is perfect, essentially, while the pelvic floor muscles are firing up. Phase 3 is, oh, sorry, I went ahead of myself. So this was just a walking example. And this is where you'll see the opposite holds true. So now you see green overriding red. So that means the abdominal activity is significantly higher than what the pelvic floor muscles can generate. And as a result, we get leakage. And in this situation, the individual that was performing this was, in fact, leaking during this session. Okay, so you can kind of appreciate why walking is one of those moments where we have circumstances of leakage. Phase 3 is where we fasten the faucet. And in this phase, we talk about various techniques, but one of the big ones that I wanted to mention to everyone here tonight is the urge suppression technique. There are ways in which you can optimize your control, but what I will say, and again, this will be available on the ebook, so I'm not going to go through each detail of this strategy, but one thing that was really, really cool is that if you can everyone see me in the image? I know it's kind of small, but if you think about the spinal cord coming in through the back, and then the nerves that come off the spinal cord come out and they would activate the bladder. Okay, so there's signals that come down from the brain, and then they'll go to the bladder and they'll tell the bladder, okay, squeeze and empty your contents. But the cool thing is that off of that very offshoot that comes off the spinal cord, there's another offshoot, and that offshoot goes down to your calves and feet. So if you actually start to do toe curls and ankle pumps with your feet, I'm using my hands, but you get the idea. You can actually pull away from some of the signal arriving to the bladder, and you can pull it down into your calves. Then what ends up happening is the urge to pee will go away. So sometimes you're in a car and you feel the urge to go when you just got into the driveway and you've got to really go. Well, maybe before you get out, you start doing some ankle pumps and some toe curls, and you do some breathing and you do a gentle Kegel contraction, and you start waking up your pelvic floor muscles again, because if you've been sitting for half an hour or however long you've been in the car, then you can imagine these muscles are not just going to bounce back and all of a sudden be ready to go for you. So there's some strategies there that you can use to try and prevent any moments of leakage in those circumstances. Phase 4, we talked about the importance of posture and pelvic positioning. So naturally, we've included it in our prostate probe program. And there are a number of exercises that we teach our patients. And although maybe some of these look like they're impossible for you to do, I can assure you that every person we put these through are able to attain them, because there are always modifications available and propping and other ways to execute. So we always find a way to get the results that we're looking for. Phase 5, our recovery tips. And so this is where we really start talking about hydration, weight management. If your waist circumference is or higher than 95 centimeters or 37.5 inches, and that's from the belly button, not from your belt line, then obviously we start thinking about how we can start working with reducing that. Because if you can take some load off the pelvic floor, that's going to make a world of difference right away. With respect to engaging the pelvic floor muscles into activities of daily living, we've talked about the importance of doing that. And the key thing here is consistency and patience is key. It takes 10,000 hours before someone can master something. And I'm not saying that it's going to take you that long, but to really become proficient with this, there does take some practice. And so you do have to have some patience when working on this. And then phase 6 is our early penile rehab phase. And this is where we start working on, actually, it comes in 1 to 2 months post-op, and we do not delay on that, regardless of whether or not the man has recovered his continence. We initiate this as soon as we're supposed to, because we do not want the tissues of the penis to undergo any kind of structural changes where now there's potentially some scar tissue that deposits. And then the vessels become hardened because there's been no blood flow in that space over the period of time that erections are not independently possible. And so we get our patients working on the various treatment options, starting with the introduction of low-dose Cialis. Typically, it's between 2.5 to 5 milligrams per day. And obviously, that's going to be something that you talk to your doctors about, because that is beyond the scope of our practice as physiotherapists. But certainly something that I have read in the research and in my travels in Australia, working with a sex therapist there. And then the second line treatments would then involve the Keegels, which we've discussed quite thoroughly at this point, and the vacuum erection devices. So those are the devices that you see in the far corner. I prefer the Androvac, which is the one with the white head, and that one is automatic. I've used various kinds over the years, but this has been my preferred device, just because of the ease with which you can use it, and obviously because it's automatic, so it's just easier for managing and handling. This basically draws in through negative pressure blood into the penis, and it causes constant stretching of these tissues, preventing the stiffening that goes on as one is no longer able to have erections. And so it's something you use about 5 to 7 times a week. So it does need to be done daily in order to ensure that the tissues stay viable for when the nerves come back online. And you may or may not know that can take anywhere from 1 to 4 years, depending on your age and a number of other factors, and obviously pre-function and those types of things. There's certainly your commitment to this as well. I have some patients that just can't seem to find the time to do this, but yet they want their erection back. So, I can appreciate that it's difficult. I do suggest that my men place it in the bathroom so that when you get out of a shower, it's there right away and you're conveniently naked. And so you can just put it on right then and there. The intracavernosal injection, again, something that you would seek medical advice for. So your doctor would teach you how to inject this trimix solution into the penis, and within about 10 minutes, you would get a good erection that would last pretty darn close to an hour. And obviously, they talk to you about the risks associated with over injecting. This is something that should be used in combination with the vacuum erection devices because it's only something you'd use maybe 1 to 2 times a week. But the vacuum erection device is a daily use, and so that ensures that these tissues are being stretched regularly. And then, of course, your third line treatment options are your penile prosthetic implants, and the technology is quite fascinating. Again, while I was in Australia, I had the opportunity to see this, and I've provided an image here. Basically, it's two uh, implants that get filled with solution that get inserted on the top of the penis, and through devices that are housed in the testicle, you can actually pump them up, and then all of a sudden you have an erection, and then you can also basically release the pressure, and then the erection goes down. The erection looks, I couldn't even tell, to be honest, that it was a prosthetic implant. That's how good these things turn out. And the research is very clear that there's a very high 90%, I think, satisfaction rate with this approach. So there are always options, and I know that this is always a daunting part for men. And as I've been working with men over, several years now, I can appreciate how difficult this must be, and I hope that there's at least some hope that it's not all gone, that there are options out there, and I'm happy to talk to you guys about that and guide you in the direction that that you need to get to. Now, one thing that we do know is that heart health is directly correlated to your heart health. And so in our Prostate Pro program, we have also considered this, and we certainly don't overlook the importance of your cardiovascular endurance. And in our program, we have combined circuit training to not only target the muscles, but also to target the heart. And we naturally would encourage cardiovascular training independently of our Prostate Pro program, but certainly it is an important factor, because if your heart can't deliver blood down to the smallest vessels that are located in your penis, how are you going to get blood flow down there? Right? So the pump has to be sufficiently strong to be able to project enough force into these tissues. And if these tissues haven't been stretching all that much, then naturally it's going to be even more challenging. Hence why early penile rehab is critical, but so is maintaining the power of your pump. And then finally, the phase 7 is our Prostate Pro exercise sessions. And these sessions are offered every Saturday morning. They are offered virtually. And here they're supervised by yours truly. We go through an exercise session capturing things from a dynamic warm-up to balance to strength to cardio. We have Keegels that get introduced into all these movements. We have a nice cool down that targets the mindfulness and the relaxation aspect of things as well. As I've mentioned, we have modifications that are provided for all fitness levels and bladder control levels. So it's one of my favorite things to do, of course, is teach exercise, and we have a lot of fun. It's a great way to socialize with men as well. And in the future, we're actually hoping to get a facility where we could start providing this live in person. So that would be coming hopefully soon. With this program, what you do also get is a series of exercise videos that we've created, and they basically take you through an exercise session, just like you would, purchase on Fitness, Apple Fitness, or any, Peloton, or those types of exercise apps. We've basically, I won't say copied, but we take the same format has been utilized, where you can just follow along with the exercises. So the take-home messages are that technique matters, right? We are Kegeling. We are no longer Kegeling. Intensity matters. You have to train to fatigue, and it really if you're just doing kind of quick contractions and you're not feeling fatigued at all, then naturally you're not going to get the results from your training. Of course, global conditioning, we've talked about that and how that has a huge benefit on improving urinary incontinence post-prostatectomy, as well as your quality of life and preventing, cancer reoccurrence. And the evidence is very, very clear that exercise has shown to reduce cancer reoccurrence. So another benefit of being part of our Prostate Pro program. Preoperative training is ideal. So if you are still waiting for your surgery, please contact a pelvic floor physiotherapist that works with men. If not out in your location, I'm happy to do virtual sessions as well and help as many people as I can. And then finally, remember, penile rehab has to begin 1 to 2 months post-op. Whether or not you are continent, don't delay. I have men say, well, I want to make sure I'm continent first and then deal with this erectile business later. I can appreciate if it's not something you're interested in at all, but it's still the health of the tissue. And you can see that the muscles are part of that, right? So whether or not you want that function back, it's still such an important piece of the puzzle that I certainly wouldn't overlook it at this point in the game. So what are my next steps? Well, we certainly encourage you to email us if you are interested in receiving the free ebook that you guys will be having access to for attending this evening's workshop. So all you have to do in the subject line is just put free ebook and then shoot us off an email, maybe give us some feedback in terms of what you maybe would have liked to have learned more about, or maybe you have some questions, and I'm happy to answer those as I can. So just put that in the subject line, and then we'll put you on our wait list. We're just trying to get the rights, the copyrights, and just protect the ebook so that it can't be copywritten or stolen, essentially. So as soon as we get that process finalized, the ebook will be available to the public. And the next thing, of course, as I've mentioned, is booking an initial assessment. So if you want to work one-on-one with myself, we can do it virtually. You don't need to travel all this way. If you do want to try the biofeedback, then of course that's something that would require a trip out to Ancaster. But most of this can be done virtually, and I've had some great success with that, even through COVID. So please don't feel that is a lesser option for you. And then, of course, the Prostate Pro program. If you're interested in the Prostate Pro program, just put that in the subject line, and we'll also put you on our list and contact you when the next session is up and running. So with that, I thank you so much for your attention. I hope you guys have learned a great deal of new information that you will hopefully be able to add to your toolbox. And at this time, what I'll do is I'll stop the recording, and we'll have some time to ask some questions.